The World Health Organization, WHO, declared tuberculosis a global emergency in 1993, and it remains one of the world's major causes of illness and death.
Now, although it is preventable and treatable, it remains the world's deadliest infectious disease. Tuberculosis is an infectious disease caused by bacteria, which typically affects the lungs. It is spread from person to person through the air, and when people with the disease cough, sneeze or spit, they expel the bacteria into the air and others become infected.
Common symptoms of active lung TB are cough and sputum, as well as blood at times, chest pains, weakness, weight loss, fever and night sweats, among others.
6 countries account for 60% of the total tuberculosis burden. India leads the count, followed by Indonesia, China. Nigeria ranks 4th, followed by Pakistan and South Africa. And that's according to the 2016 Global Tuberculosis Report released by the World Health Organization.
Nigeria bears the greatest burden of tuberculosis in Africa, and according to Nigeria's National TB and Leprosy Control Program, nearly 8 out of every 10 cases of tuberculosis go undetected.
And joining us right now is Senior Registrar, Department of Community Health at the Lagos University Teaching Hospital, LUTH, and a member of Association of Public Health Physicians of Nigeria, Dr. Veli Emina. Good morning. It's good to have you on the show.
Us.
Good morning. I'm glad to be here.
Let's start this way. With our prologue, we tried to define exactly what tuberculosis is and how it presents. But how can you immediately tell when you're coughing, for example, that this is TB and not just ordinary coughing?
Okay. The teaching is that once you're coughing for more than 2 weeks, if someone has maybe a cough and it's more than 2 weeks, you should think of TB until proven otherwise. The other symptoms are associated with TB, apart from the cough, you could also have chest pain, you could have fever, you could have weight loss, you could have weakness, anorexia, and so on. But once someone is coughing for more than 2 weeks and you've used some other things and the cough is really not going, you think of TB until proven otherwise.
And now, Nigeria ranks 4th in the global report of the burden of tuberculosis across the world. Why is that? And India is number 1 as well. Is it about the population that is somehow engendering the spread of the disease?
Well, not really about the population. Apart from the number, we know that tuberculosis is linked with poverty, and a higher proportion of Nigerians are still living under $1 per day. So that poverty is related to TB.
How does that affect the spread?
Yes, because we know that TB is associated with overcrowding. 1, poor nutrition, when your immunity is low. So if you don't have enough money, you cannot really eat healthy, good food that will boost your immunity. So your immunity might be low, because ideally, if your immunity is okay, the TB should not manifest, even if it's present. But when the immunity now goes down, maybe somebody is not eating enough, somebody is sick or is on some drugs, and the immunity goes down, you know, what we call reactivated TB. Some of the TB that the bacteria that have entered before becomes reactivated.
So what you're saying then is that there is a strong possibility of actually having TB, or the virus that causes TB, the bacteria that is, and really not present the full-blown disease itself.
Yes.
That's interesting to note. Yes. But the WHO has said that the efforts and interventions so far carried out have saved about 37 million or so lives globally. Yeah. But Nigeria remains a basket case, sort of. It seems not to be working in Nigeria. What are we doing wrong?
I will not say it's not working in Nigeria. I think at least to some extent, we've put some effort in place. And I think we're also trying to get it under control.
But what are some of those efforts that you can tell us?
Yes, we've moved from different strategies. You know, there's a time we are doing the Stop TB program, and now we are in the End TB program. We have drugs. Most of the, at least in Lagos, we have drugs in most of the health centers. We have the DOT center, where you can go and get free drugs, where you take the drugs directly in the presence of a health professional, a health worker, to ensure compliance to the drug. And most of the time, the DOT centers are closer, very close to where people are living. And we still do some form of contact tracing. If somebody has TB, we still try to get those that are around that person, maybe the spouse, the children, the family member, we do contact tracing so that we can try to get others that could have been exposed.
But it seems it's not working because Nigeria is still one of the worst countries battling with TB. And of course, there's a report that the country has a low detection rate. And then there are accusations that the country is not even using the globally accepted and approved strategy to tackle tuberculosis.
We have our challenges in Nigeria. We will not say we are, well, getting everything quite right, but at least we're trying. And some of the challenges we have, like I said, poverty, overcrowding, because it's not only just health alone. Some people live in very unhygienic conditions, and because of this recession of this Nigeria states, you see a lot of people overcrowding, 5, 6, 10 people living together. And once somebody starts coughing and it's TB, it goes round.
So you mentioned DOTS earlier as one of the strategies. You want to explain exactly what DOTS is, and really how close is it to, in terms of proximity to is it one per local government or per council, or how accessible are those DOTS?
Yeah, we have the DOTS is called the Directly Observed Therapy or Treatment, in which someone that has tuberculosis has been tested and confirmed to have tuberculosis. We go to the health center and get the drugs directly from the health worker and take the drug in the presence of the health worker.
And the drugs are free?
And the drugs are totally and absolutely free. Okay, and most of the time, in Lagos State, for instance, we have like some local governments have like 3 or 4 health centers. Some don't have that much, some have like 2. They are not like evenly distributed, we understand that. But at least in some local government, like in my local government, I stay at Alima Shop, okay? And in my area, at least you could either go to Fokanizer, there's an health center in Fokanizer at Akomaje Bristol, and there's one at Okwala, Rauf Aregbeshola. So, and those they're accessible. When you go there, you can get those drugs free, and you're supposed to take the drugs under the supervision of a health worker.
All right, now there is the problem now, and it seems that is one of the cases leading to the spread and, of course, persistent existence of tuberculosis in Nigeria and across the world, and that's that they're kind of resistant to some drugs. There's the case of multiple drug-resistant tuberculosis and even extensively drug-resistant tuberculosis, and Nigeria is even ranking high as well, with many patients having that. How do you tackle this?
Yes, we know multi-drug resistant, though it can occur anywhere in the world. But in Nigeria, because while there's low awareness, some people don't really know that you have to take the drug judiciously. They just believe that if I take it, I can miss 1 or 2 pills, you know, I can still get away with it and come back and continue taking the drug. But it doesn't work that way, because the TB bacterium can develop resistance, and once it develops resistance, it's very, very difficult to tackle.
Okay,
so you need to move from the first line drug to the other line drugs. And that first line drug is the most effective.
Are those other line drugs really available, easily available in Nigeria?
And free?
Exactly. Now, talk us through the process of detection, of finding out that a person actually has this disease. What is the treatment process, and for how long does it last that you can say a person is TB free?
Okay, the treatment, the first step is once you are coughing for at least more than 2 weeks, try and go to the health center or the hospital to get tested. But the issue that most people don't even want to even do that. Some people don't even believe that they can have TB. They just believe I cannot have TB. Where will I get that from? TB of all cases. So they don't even want to go out. So the first thing is to create awareness and start telling people that, okay, if you see anyone or you know anyone that has been coughing for 2 weeks or more, you need to go to the hospital and get tested. Right. So when you go to the hospital, they will give you some bottles to take home to put in early morning sputum. And I mean early morning, when you wake up the morning before brushing, you produce those sputum. And they will take the sputum.
Sputum is
saliva.
Saliva. So sorry. It's saliva. What you
try to keep it simple.
When you cough out, it can, what you bring either whitish, yellowish, whatever the color. Sometimes it can even contain blood. So so you bring it out, they give you a container, 3 containers, you put it into the container and take back to the hospital. So they will run the test, the acid-fast bacillus test, to check if that bacterium is in that sputum. They will do that. Once they do that and it's confirmed that it's there, the next step is to start the treatment, which is to start immediately. So there are two phases to the treatment. There's the intensive phase, which lasts for 2 months, and the continuous phase, right now, which lasts for 4 months. And so you're supposed to take the drug judiciously every day, if possible, at the same time every day. Because the drug, there's a way drugs work, just the half-life, so that they can meet and be more effective. So when you take, and you're supposed to do some tests, apart from the sputum, you do chest X-ray, and also they can monitor your programs. So when you are on the drugs, after the first 2 months, they'll still take your sputum again to see, okay, is it still there? Is there improvement? Because at that first 2 months, that is the stage in which you can transmit the disease to other people. So that's the stage you need to be extremely careful. And that's why I say, when you're coughing, you have to cover your mouth with hanky. You have to make sure that
you quarantine yourself.
Yes, let's quarantine. Yes, you have to cover your mouth with something. Let there be some distance between you and the other person that you're talking to, because it's like air droplets. It's in the air. When it comes and it goes into the air, and people can.
Okay, we understand that people living with HIV are somehow susceptible to tuberculosis infection, and many of deaths recorded among this set of people through complications of tuberculosis, or simply just having TB. Why is that?
Yeah, I said that tuberculosis is linked to low immunity. And we know that the human immunodeficiency virus affects the immune cells, affects the immunity. So anybody that has HIV, the immune system will be low. Because the HIV virus will attack the immunity. And so once the immune system is low, TB will thrive. The tuberculosis bacteria will just come up and thrive.
So is there any special treatment, or is it normal treatment? Because
they have drugs. Anybody that has both the HIV and TB, they have special concentration for them. They combine it for them.
So they combine the drugs. Maybe very quickly, what are the implications of undetected TB? We're told time up. One word. What does it mean for us?
TB, the complications are enormous. It could lead to deaths.
Enormous. Dr. Emina, thank you so much for enlightening us on this on TVC
Dangers of TB, and of course the need to get tested once you have
as
any
quickly
form of cough,
as possible.